Good afternoon, everybody. I hope you enjoyed a very nice lunch. Very grateful to our hosts for feeding us so well. Before we start on the afternoon panel properly, this morning was quite busy. Okay. This morning was very busy and people may have had limited time to ask questions or make points. So if there are any questions that people didn't get the opportunity to ask this morning, most of our speakers are still around, or if there's any points people would like to make, there is an opportunity now if you'd like to take advantage of it. The microphone's there. This looks good. Just wait, just a moment.
Thank you. Mykola Syoma, Ukrainian Legal Aid Foundation. Regarding naloxone issue, with my colleagues from Ukrainian police, we discussed the issue, and colleagues are worried about the responsibility because naloxone is about opioids, and today in Ukrainian market, too many new drugs, absolutely different nature from opioids, and if a police officer give a naloxone, who will be responsible for? In your perspective.
Where you go.
Do you want me to answer that one?
So.
Yeah, okay, so I understand that concern, and that is a concern that has been raised by police wherever officers are carrying naloxone. The first cops to carry naloxone were actually in the United States, and now of course it's happened in Scotland and a few other places. It happens in Estonia. The first thing to say about naloxone is that it's completely safe. You cannot harm somebody with it. One concern of police is that they are concerned that it's a medical procedure, so that by taking on that responsibility, they then could be judged if they do something wrong. But having been trained, I'm not still in the police, but I carry naloxone just because I can. There's always one in my car wherever I go. It's not complicated. It's really not complicated. The risk just isn't there. But me saying that is not enough for most police. I understand that. So what I can say is that these concerns have been raised by police and also the legal professionals that support police in terms of liability on both sides of the Atlantic. So all of these questions have been looked at. What is the risk? Is there an additional insurance risk, for example? And the answer is no. It's actually very simple. There is no litigation risks, providing the training is carried out and somebody's trained. But to be honest, it's so simple that I believe I could probably train you on how to do it, describing it to you in 5 minutes in the corridor, because it's that straightforward. So the answer is, your concerns are typical of police, and all of these things have been covered both in the detail of the training, the considerations of liability, and all of the other legal considerations. And one thing I would say is when Police Scotland present on this, they do this incredible job of actually showing police officers speaking to camera who have actually used naloxone. And one of them sticks in my brain. I'll never forget seeing it, because he says, I've had to give death messages to people who have died from an opioid overdose. I've had to do that. I've had to tell the parents. Now that I've saved someone's life with this, I know what I would rather do.
I just asked, yeah, it's working. From the Estonian police, our police officers were absolutely concerned. They didn't want it at first because it was only injection, so no possibility no one wouldn't want to do that. But right now there are like sprays, and it's so easy, and the police officer has the right to decide if he or she wants to use it or not. If he or she wants to use it, then there will be a training to use it. And you can't prosecute the officer if he does something wrong.
I mean,
Can I say something? Sorry.
get going, please do.
Let me make myself useful. So, hi, I'm Monica Ciupagia. I'm the thematic lead for drug use and HIV in UNODC HIV team. And I do training and prepare people to administer naloxone for a living for a couple of good years. So naloxone doesn't have contraindication. When you see a person that is on the floor and is not breathing, they have an overdose with heroin or other opioids. And if you administer naloxone, it works like magic. They start breathing again, they regain conscience, and then depending on how potent was the substance, they will be awake for a couple of hours and they can be helped, or they would need to get naloxone again. If the person is intoxicated with another substance, naloxone is just like giving them a glass of water. It will not help with the intoxication for another substance, but it will not harm them. So it's not, especially when the naloxone is the nasal spray, it doesn't need any training to administer. You just administer a nasal spray. So it's not something that will put any first responder in danger if they administer the naloxone to somebody who is lying on the floor and is a victim of an acute intoxication. Thank you.
Was very useful.
Добрый день. Казак Игорь, организация
I'm Kozak Igor, organization Input.
Хотел два слова сказать за налоксон.
I wanted to say a couple of words. Igor is from community, and I wanted to say a couple of words on naloxone.
Мы сотрудничаем и с врачами, и в Украине,
In Ukraine, we're cooperating with doctors as well.
В карете
In the Ukrainian
скорой
ambulance,
помощи
they have naloxone with
есть
them.
налоксон, да. И иногда вот была такая ситуация, просто человеку плохо. И опытный врач, он не знает, есть передозировка, нету передозировки. Он просто делает налоксон как профилактика передозировки. Он не знает, или там сердечный приступ, или еще что-то. И мы знаем такие случаи, когда люди вот так оживали на глазах. У него там шприц с вены не встречал. То есть нельзя было так сказать, что это передозировка. А после налоксона человек приходил в себя.
Thank you. Sometimes when the ambulance could see the person who is bad, and they are doing a preventive shot of naloxone. And sometimes there were lives who were saved by this preventive shot. You could not see the needle in the van in this moment. You could not understand, and doctors could not see is it overdose or not. And just to prevent the death from overdose, they are doing the naloxone, and that's saving lives. There are no nasal naloxone in Ukraine. It's only injections, unfortunately. Oh, big discussion, Dave. I don't know how you will manage to continue.
And actually, from the police officer view, the naloxone is a good tool to protect the police officer as well. If there's some kind of, situation, and our police officer gets injection or whatever, the naloxone is a great tool to help the police officer as well.
That's certainly an argument that I've used when I was trying to make the case in London. But reference was made to the police union earlier, and they're still quite obstinate in resisting this. But our colleague used the word magic, and I think I've worked with police officers who've used naloxone, and you know, the fact that they've saved someone's life has quite an impact on them and professionally makes them feel pretty positive. So actually, I think we're slowly winning the battle. We're winning the battle in the UK because more and more people have used it, and a lot of those concerns, you know, they evaporate in practice. Are there any other questions or points from this morning? If not, you're telling me to hurry up. Okay, it's good to get some direction. If not, Neil, would you like to do the first presentation? There's a slight change in the order of speakers this afternoon, but we're going to be looking at barriers and ways to get over barriers, which is kind of very relevant to where we've just started.
I'll come up here for a change of scene. You're probably a bit fed up of seeing me already today, so I'm sorry you've got to listen to me again. But I'll be quite brief as my part of this this panel. I was asked to talk about the situation in the UK in terms of drug safety testing and the barriers that we have and the way things have taken shape. And it's an interesting situation in the UK because I mentioned earlier on about British police having a commitment to following evidence. And it's again a story of that happening because in the UK we have this extraordinary contradiction going on. We have arguably one of the most punitive drug control systems in Europe, that we do more search warrants, we kick more doors in, we do more undercover work, and we have the biggest prison population per capita in Europe, at least in part because of our punitive drug policy. So you've got that side of things going on, which the police are obviously a part of, but you've also got this fascinating development of an evidence-based health response, which is oddly actually being led by the police. So I think it was 2015 was the first time we had drug safety checking in a music festival. Now, we've heard Peter talk about music festivals today. Secret Garden Party was the first festival, quite a big rich person's festival for the most part. It's people with expensive tickets and expensive tastes go to it. And the first safety checking started there, but within a few years, I think we had as many as 12 music festivals. Now, UK has a lot of big music festivals, and this was some of the bigger ones where they had safety checking. But this checking didn't happen because of any change in the law. It didn't happen because of any political direction, either local, regional, or national. It happened because the police decided it was a good idea. Now, what that meant is that, so in England and Wales, where this happened, we have 43 different police forces, some of them bigger than others. In the police forces where those festivals happened, there's an organisation called The Loop, who I admire very much. We have similar organisations in Spain, where they initially were an advocacy group, a campaign group to allow this to happen, but eventually they got the agreement locally with the police. So I'm talking about the police force which actually had that jurisdiction of where that festival was, got the police to agree to a temporary and localised decriminalisation within that festival. So what the police agreed to was that they would allow a space, a public space in that festival for anyone in that festival to go to the facility, take a sample of their drug, either a quarter of a pill or a small a sample from a powder, whatever it is, just enough for the test. They would take it into the public part of the festival, give the drug to them, and within an hour, they say 2 hours, it's usually within an hour, they will have an exact reading of exactly what is in that drug, using the most practical modern technology for doing the test, which is laser spectroscopy, which is a portable device. It's quite expensive, but it's a portable device, and it's incredibly accurate. Then what would happen is the person would come back, they had their, like a lottery ticket, their line in the queue, and they would come in, and they would sit in front of a trained harm reduction worker. And for most people, young people, for the most part, this is the first time that they've ever had any advice at all about drug consumption. The first time. And they would sit across the table from each other, and this would be a qualified person, and they could have an open and honest conversation about their drug use and what the risks of that drug use were. It also meant that they could accurately tell them what was in that drug, whether it was what they thought it was, what adulterants it had with it, what the strength was, and they could give them pragmatic, practical advice how to keep themselves safe. Now, in the UK, we have had a series of drug deaths in almost every festival. It was a regular story. During the period of time where we had this safety testing, we had no such problems. We didn't have the same overdose problems in the welfare tents. All of the people who are tasked with looking after young people in these festivals stopped having the problems. They weren't getting people in an overdosed state that they were concerned about. So it dramatically reduced the necessary medical interventions. Also, 3/4 of the people who took part in this, the people who were giving a sample of their drugs, 3/4 of them said they would now no longer take that drug, or they would take a reduced quantity of the drug that they were intending to take, following the advice that they've been given. A very specific, targeted piece of harm reduction advice to a vulnerable population. Now, the very British part of this story is that this could not have happened unless the police were in agreement. And the police agreed to do that, to decriminalise this little plot of land in this music festival, because they recognised that the first duty of police is to preserve life, and that there was an evidence base behind this in order to help them do that. That was the basic thinking process. But this is the fascinating thing. They did that in spite of politics. And they even got public criticism from politicians who were saying, well, how can the police encourage drug use? They weren't encouraging drug use. They were just recognising that drug use happens because, hey, humans take drugs. This is a way of life that we have to get used to. So that is the situation. Now, unfortunately, the success and the growing evidence base of that safety testing at festivals, it has brought a political change. It has forced the government to look at it. But unfortunately, what's happened as a response is that politicians have got involved and it's slowed it down. So now, for the moment, we have no front of house, direct one-on-one drug safety checking that was working. The only license, now that it has to be licensed, now that the police, it's not a police decision, now it's a political decision, we now only have back of house testing, which means that there is a lab on the site of many festivals. They get samples either handed in or seized by the police, or people can voluntarily drop it in if they're concerned. And then what happens is the back of house testing, again, with the laser spectroscopy machine, that information is then sent out into the festival and beyond, because it goes national and international, actually. It becomes useful information for anybody who's taking drugs. We get the photograph of a tablet or whatever the description of the drugs are, and people are warned of it. But we have this situation where we now have everything has slowed down. The good news is that as of last week, we had the first nighttime economy drug safety checking happening, and that's in the city of Manchester. So things are moving, but it just feels, certainly as a former police officer, who can be proud of, I'm proud of the way things went and the fact that that happened because of good police leadership. I'm proud of that. It's a shame that things have taken a step back now that the politicians have got involved, especially as the public are overwhelmingly in support of this. And I think, David, you alluded earlier on the fact that sometimes politicians are too slow to follow what public opinion is. So that's the situation with drug safety checking. But another thing I'll just add there, that in this localised decriminalisation is also matches a broader pattern of police decriminalising in local ways. So there are many police forces in England and Wales who have brought in diversion schemes. We've heard about diversion schemes today already. But again, the diversion schemes that we have in the UK, some of them are pre-arrest. So people are being diverted and they're not even being arrested. They're just given an appointment to go and see a drug worker. That's all they're getting. The drugs are taken off them. They're given an appointment, given some advice, and they're gone. There's not even a record of arrest. The police who have those systems, they love it because it saves them a whole lot of work, a whole lot of time that they'd rather be doing something else. And guess what? The health outcomes are better. Recidivism is better. People are less likely to come back into the criminal justice system if they've never been there in the first place. So it's positive for the police, it's positive for the public. And again, where that's happening in the United Kingdom, it's being led by the police, in spite of politics, not because of it. So that's the story from the UK to the moment. Thank you.
Thank you very much, Neil. Are there any specific questions that people would like to direct towards Neil now?
I kind of know the answer, but I need to hear from you. You are talking about drug checking with the proper equipment. How bringing this equipment was justified for the local police? Is it harm reduction tool or research? Because usually we are using in our region that if you're using the equipment, then you are doing it with university and justifying it, it's just for research purposes. And the second part, do you think that reagent test will work in the same proper way? If you couldn't bring the research and nobody will okay with taking the drugs from person, because the key obstacle legally, which our social workers saying and our police saying, that if I am taking a drug from the user, even the tiny piece, then I am in danger as a social worker while I am testing it. So I need to be protected in this moment. That's why we are introducing, just for start, drug checking in some countries of this region. It's already introduced during the nightlife festival. We are introducing this, easier, but not proper chemically showing what is in there, but as a starting point for the harm reduction talks as well, the reagent tests, if I write in English.
Yeah, so the laser spectroscopy device, if it's being used in the way that I've described, it's a harm reduction tool. And it should be a harm reduction tool. It should be purchased by local authorities or wherever as part of your health response to drugs, wherever it can be used. Because wherever you have that point of contact with the drug supply and the people who use drugs, in the absence of a regulated market, of course, with the situation that we have now, it's an incredibly powerful tool and system to actually save people's lives. And this is saving people's lives wherever it's used. It is that simple because it's so detailed and so clever. Having said that, you mentioned the other tests, the reagent tests. I mean, they have got more sophisticated over time. They're better than previously, right, Nuria? They are better. You've got really sensitive strips to test for synthetic opioids, although obviously synthetic opioids are moving quite quickly, but still, some of the tests, they're actually pretty good. You can test for MDMA, you can test for adulterants in MDMA tablets. But really, in an ideal world, and we should strive always for the ideal, is that you need to know the percentage purity of MDMA, because we now have MDMA tablets which are 4 times the adult dose. And that's information that people need to know to stay safe. And you mentioned the idea that police will say that social workers or whoever is at risk. Well, I'm not saying this is all of the answer, especially Peter would contradict me if I said it was. But police, we need to communicate with police, and we need to be talking about this, because if the police understand the intent, and the intent is to save lives and reduce risk, then generally police get on board. That's my experience in any jurisdiction. And that is where you can start to have a conversation about about what somebody's intent is. And intent is important, right? If your intent is to temporarily possess this in order to preserve the life of somebody else, then that should be in the public interest to never consider them for prosecution. And, you know, a police leader can say that, in my opinion.
I'm just going to abuse the chair's privilege to say a few words because my daughter would shoot me if I didn't, because my daughter's done a lot of the analysis. And actually all systems of testing have their limitations. Until you get it into a lab, you crush it down, you run it through a GSM, and they're quite often surprised at what they'll find in traces, etc. But the magic really for me in a lot of this testing is the engagement with the user. And I think the fact that you even have, because you're only going to be able to test hundreds of pills or powders. You're not going to engage with 50,000 people at a festival. But the fact that's happening changes, I think, the way people behave and the confidence for people to report if something goes wrong. So that is, you know, the point I was making earlier. People will have the confidence to go and find a medic, maybe even a police officer on site and say, my friend's ill, because they know they're not just there to try to arrest people. It's a very different vibe, and that's really important. That's, you know, to an extent, the testing is almost a ticket to ride in terms of the engagement. But we do need to do a lot more work, and not just in analysis, but sharing that information. And sorry, you had a question.
Please, I'm first. Sorry, I don't know English. I can speak Ukrainian.
Що ж ти мучаєшся? Давай.
Шановні експерти, таке питання. Регіон СЕЦА, Східна Європа, Центральна Азія, ну, низький показник передозувань і смертності передозувань. Тобто
In our region, in the EECA region, there is rather low level of the statistics in overdoses.
Тобто питання, як саме фіксуються випадки передозувань, смертності передозувань в ваших країнах. І я так розумію, що високий рівень смертності якось впливає, спонукає до дій щось змінювати.
That's actually the question of the medical and death statistics, because if the proper statistics and recording and of the cause of death is done in your country, like in US, they recognize it in CDC, the overdose crisis through statistics. So do you have any specific approach to the proper statistics to get proper data on the overdoses in your countries, to use this data for the advocacy to change the system and to have harm reduction? Complicated?
Yeah, I mean, thanks for that huge question. You've highlighted a big difficulty with the data. So in many countries, there are different aspects of difficulties with data. I'll talk about the UK. So if you're talking about overdoses, things aren't adequately recorded because at different points in the system, different people don't understand the context of the information. So, for example, where we have incredibly high drug deaths, but many of those drug deaths are missed in the coroner's court because the coroners don't understand the data which is presented to them from the toxicology, and there are major mistakes made about the nature of opioids and what the opioids are broken down to in the blood. So that's just one example of many where the data is inaccurate. So, but I think your question is, can the information from drug safety checking feed into policy around drug deaths and how to respond to it? I think we're a very long way away from that. I'm not even sure. I mean, you mentioned the USA. I don't think that the USA does things particularly well because it's all very regional and the level of expertise and specialism in different parts of the United States varies massively, as does the stigmatized approach in actually deciding to record that information and how to present it. So that's what you've asked is a really complicated thing, and I suspect that those kind of ways of feeding data into policy making to be of any benefit, I think that'll come after we've got legal regulation, to be honest. I'm sorry to be gloomy with that answer. I hope that does answer your question.
One thing I would add, the information that Neil shared about the reduction or where festivals have testing and other good practices going on there, the fact they don't have fatalities does influence local policy, because I am aware of local authorities and police forces requiring festival organisers to put in place some of these approaches because they're very sensitive. Although, you know, compared to our opiate deaths, the number of deaths because of MDMA at festivals is tiny, but they tend to be younger people and they get a lot of media coverage. I couldn't tell you the last time we saw a heroin death on the front page of a major British newspaper. But if a young person dies at a festival, that will get media coverage. And that does influence, and the fact we've got a body of evidence building around what reduces risk at festivals, that does have an impact locally, but not nationally.
No, that's because they're white and middle class, though.
True.
Can you hear me? I think you can. Neil, you described these non-punitive interventions by law enforcement, by the police in the UK. I remember from a couple of years ago, I think, there was a discussion about such measures, and at the time some high police official explained that he doesn't support these interventions because if there is no arrest record, no criminal record, then the police lose sight of the extent of the problem. They don't, if there's no record, they don't know how much drugs are around, how many people are involved in drugs and so on. That there has to be a record in order for them to adequately react. How did they overcome it?
Yeah, okay, so I mean, that's a good question. We have very significant regional differences within our policing within the UK. We also have a weird system where we have elected officials locally, regionally, in control of local police forces. So we have people of different political persuasions and different ideologies who are setting the parameters of how the police should measure what they do. So that's one influence. But I think what you're quoting is actually from London. And you'll tell me, right, that London's a beast of its own. It's a totally different way of policing and a different ideology. What I would say is, though, that I am confident that within the police leadership of the UK, despite us having these different messages, within the police leadership of the UK, the vast majority of police leaders are in support of these measures because the evidence backs it up. The chief of the Met in London is a political animal and has a different role in the public discourse of the UK. So there's two things going on, and it's, you know, there are these conflicts, these pressures within how the police face the public in most nations. But I think it plays out unusually publicly in the UK. But what I would say is the majority of police and leaders are very, very wholeheartedly in favour of these measures which can save lives.
Oh, and a question.
Yeah, just a small intervention on the drug testing.
You're going to end up with two microphones.
But I'll keep it brief. We do drug testing, but it's all confiscated drug because drug testing is not allowed legally in Belgium. But we also see that when you test drugs from the same batch, you have pills with a very active substance and the same pills with no active substance. So there is also a critical danger that people think they swallow the first pill without any active substance and they start swallowing 2 other pills with a lot of active substance, and then you get overdose as well. The deaths we have, and we have almost casualties every year, are mainly based on polydrug use and people who are starting to combine a lot of drugs and alcohol and they really go all the way. So even if you have drug testing, I think the main positive issue is to start a debate and you have a preventive sensibility issue there. But the drug testing itself, I think we have to be careful by expecting too much of it. It's part of a policy, I think. It is a political debate in Belgium right now as well, drug testing. And then the second thing is, how can you brief your police officers to, you have an environment where drug testing is allowed, and there is a risk of being arbitrary in checking people as well, because then if somebody says, I have this amount of drugs on me, I'm going to have it tested, so you're allowed to go, and then somebody else who is a bit more under the influence of and doesn't have this narrative, then he will be checked. So it also requires some police tactics, and so it has to be integrated in a complete policy, in my opinion.
Yeah, absolutely. It needs to be part of a broader strategy. But all I would say is that where the British police forces allowed it to happen in the festivals, they did all of that work. And it's notable, actually, that if it's Secret Garden Party and some of those other festivals, you don't see any police. The police take the decision to not be anywhere near it. That they are at the points of entry and they do all of the things that police normally have to do, but in a very, very minimal way. And that's part of the agreed strategy as a partnership with the health professionals that are involved in the festival, and also in partnership with the festival organisers as well.
And I'd just add, it's actually quite a good way for the police to build their intelligence and understanding of the drugs as well. I won't bore everyone now, but, you know, I'm aware of some quite scary but humorous misunderstandings around drugs by the police, where they've allowed people to walk off who had well over any reasonable amount for intent to supply, because they just didn't know what they were looking at. LSD. Anyway, we had better move on before I get told off. Oh, is there another question?
No, not a question, it's just a smaller contribution. The cynical part is that we don't allow drug testing on the festival because of our legislation, which means that we have to check people at the entrance of the festival just to know what drugs are circulating in the festival world in Belgium. And there's this Institute of Public Health is coming to get our samples that we confiscate by police checks, just to be able to analyze what is going on in the nightlife in Belgium. So it is a bit cynical, I know. So I'm a fan of drug testing. However, if I buy a beer, I don't have a facility to test my beer. So I repeat what I said. It would be easier if Tomorrowland would sell their own ecstasy, ketamine, which has been checked before. So we don't have drug testing needed. Thank you.
But we're all aware that the Belgians produce very good beer in a very well-regulated market. So, you know, that's an argument for regulation. And just on the point you're making, I used to run a drug collection scheme in clubs in London, and literally some of them were just security bins bolted to the wall where people would sometimes get rid of drugs because they could see they were about to be searched. And it also gave somewhere for the door staff to put the drugs rather than them perhaps be tempted to sell them again. And we got lots. I mean, it won't work, but actually my biggest problem is getting the funding to dispose of the drugs. Strange. Right, let us move on now. I'm delighted to introduce Ruben Boomsma from LEAP in the Netherlands, who I know has got an excellent presentation, which will set the Netherlands policy in an interesting historical context.
Thank you very much. Thank you for having me. there is the presentation. Let's see if the clicker works. Perfect. All right, about regulation in the Netherlands, a brief overview over the last decade or century. The content of the presentation, introduction, what is LEAP Netherlands, the drug law in the Netherlands, how did it evolve. We had a cocaine factory in the Netherlands. It's very interesting. Cannabis regulation, the heroin epidemic, the cocaine debate that's currently being discussed. And then on ecstasy, MDMA, the harm of drugs, drugs testing, and the overdose rate. That's the prohibition paradox. So we use it as LEAP. You can see in the middle, public health is on its best. And it depends on the way of prohibition on the left side or legalization on the right side. And our opinion is you need to find a good balance. But I will come to that in a few sheets later. Small talk about me, very small. I work with the Dutch police force since 22 years now. Did some criminology, public administration. I'm also co-chair of the Society of Evidence-Based Policing, so there is a nexus between this debate and also what's evidence-based policing, so how can we use science in policing. And as last, the chair of Law Enforcement Action Partnership in the Netherlands, and I'm speaking on that behalf, so not as a police officer, so I have to make the distinction very rightful. So I'm talking as the chair of LEAP Netherlands. It started in 2002, maybe Neil already explained it today, I don't know. And there are many chapters. Spain is not on it, but it will be. I found out... Yeah, and Australia also has a LEAP, I found out last month. We started in 2022 in the Netherlands, and this year we are officially a foundation. So we exist on law enforcement personnel that are still active, also prosecutors, scientists, etc. And our mission is an evidence-based drugs policy, so that's the nexus also with evidence-based policing, improvement of healthcare, environment and human rights, and reconsidering penal laws. So that's our mission as a LEAP Netherlands, but also LEAP worldwide. Okay, then to the drug law in the Netherlands. So they were founded in 1919. Probably most of you, I think, will know the cause of that, the regulation of the trade because of the opium wars between the UK and China. And the incentive was to decreasing trade and use, but not total prohibition. So in the early days, the aim was not total prohibition. The Dutch, so we were against it because it had effect on our trade at that time. So we didn't want those drug laws. Then in 1928, it changed and became more punitive and more substances were prohibited. So more repression. But there was a major change in 1976. I think the Netherlands is also famous on that. We regulated cannabis already like 50 years ago, almost. So we made a distinction between two lists, list 1 and list 2. I don't know, maybe that's also the case in other countries. So hard drugs and soft drugs. And cannabis is on list 2, so that's soft drugs. And at the back you see the coffee shop Mellow Yellow, so that was the first coffee shop in the Netherlands that could sell cannabis on a regulated market. Yeah, and then afterwards, but I will mention it also in the next sheet, there came more tolerance policy for cannabis. So that's the evaluation of drug laws in the last 100 years, especially on soft drugs. This was very funny when I found out that in the Netherlands, they say it was the largest cocaine factory in the world. I don't think it's particularly true, but there was a major factory, and it existed until 1962, mostly for medical use. But it's very funny in the whole debate of drugs that we had, like until the 60s, a drug factory in Amsterdam selling drugs. All right, then cannabis regulation. Prohibited in 1953. And then in 1971 there was a committee, Holzman, and he's the upper left criminologist, very famous criminologist in the Netherlands. He was also an abolitionist, so he was in favor of stopping with penal laws. So it's a very interesting thought experiment. And he proposed decriminalization of cannabis. So I told you all the first coffee shop was already founded in 1972. And the drug laws changed in 1976 by Minister Dries van Acht. So he's the guy on the right upper photo with a joint in his mouth. He was retired then, but I think it's very funny that he did that. So, and if we go back to history, then the use of cannabis is like million. That's a lot, but 1,000 years old. And I think that's an important notion in the whole debate on drugs. So it was a major change in the Netherlands, and I think we were like a lightning country, or a country going up front in drug policy, and now slowly we are getting behind. Because over the world there is a lot of regulation policies being implemented in very different countries. So Canada, they regulated cannabis for the whole country. In the United States, I believe almost half of the states. Mexico, Malta, Luxembourg, Germany just this year. Uruguay, South Africa, Morocco, Thailand. So there are more countries regulating cannabis. And in the Netherlands, we have, we call it a weed experiment. We do it with a few cities in the Netherlands to see if this is a good choice. And this year, our neighbor just said, no, we're going to regulate it. So now we're falling behind in this whole development worldwide. And that's a bad way. Another interesting periods in the last century, and there are some parallels with the epidemics currently now on opiates, for example, in the United States or in Canada. We had a heroin epidemic in the 70s until the early 90s. And I think, but I didn't do much research on that, we weren't the only country. So if you see there were a lot of users on the streets, and nowadays, so you see the photo in the middle, that was the Zeedijk, it's called. It was famous in that period. A lot of drug users, a lot of violence, a lot of drugs dealers. In that day, no, I don't. Yeah, in that day already. Only 90s. In the 90s. Okay. I didn't know that. Yeah. Okay. This was like in the 70s, And nowadays, so the photo on the right, that's the same street. There are no drug users seen anymore. I can remember like 20 years ago when I rode on the subway in Amsterdam, you could see people just shooting up drugs. That's unthinkable nowadays. So it's a very different situation than in many cities I visited myself. And I think a major reason is the way we deal with drugs. So how did the heroin epidemic end? Because that's very interesting. And in essence, it was with harm reduction. So we started to give addiction care, methadone provision, so that's like a medicine for heroin users, drug consumption rooms. There was a famous pastor in the city of Rotterdam who had a big role in that. Medical heroin provision in 1995, so that's 30 years ago already. And afterwards, heroin became an official medicine for addicts. So not only for pain killing, but also for people who were addicted to heroin, they could get it on a medical description. Let's see. Oh yeah, so the graphic on the left, you can see up to 2023, 0.3% of the Dutch population used heroin in their life. So that's a very small amount. And also on the right, you see drug use by adults. And the graph on the right, so the smallest part, that's heroin. So the whole heroin epidemic of centuries ago just diminished. And that's my conclusion, but it's a broader conclusion, that was the cause of harm reduction policies. All right. Then a recent debate started by the mayor of Amsterdam, Halsema, so she will talk on the 4th of December here in Warsaw. She started a global debate on dealing with drugs and especially cocaine. She wrote a manifesto, and in essence, she is pleading for a regulation debate also on cocaine. You all can sign it if you want. So if you go to the website Dealing with Drugs, you can undescribe this movement. And there was one thing I wanted to tell, because the use of drugs is not prohibited in the Netherlands. So the use is not prohibited in the Netherlands. And also small amounts for personal use is not being prosecuted. So it's being seized, but not penalized. So I think that's also important to tell. And if you see the cocaine debate, but this is on a global level, and very interested in how it develops. So you see there is a lot of effort in law enforcement worldwide to decrease cocaine smuggling. Also in the Netherlands, but also in Belgium, in Antwerp, or in Spain, in the borders. And you see a movement to West Africa, so smuggling lines are going to Africa and then via different routes also to Europe. And at the same time, there hasn't been produced as much as cocaine ever in South America as last year. And there are some researchers, they say that 60% of all the produced cocaine worldwide is being interdicted. So as a law enforcement, we are pretty effective. 60% of all produced cocaine worldwide. And at the same time, there hasn't been produced as much as cocaine as last year. So it's very peculiar. And at the same time, because in South America, the violence, the drug violence is very severe. So, for example, in Mexico, in the last 15 years, more than 300,000 people were killed in drug-related violence. So that's tremendous. And if you see what happens in especially South American countries, it's terrible. And you see a correlation between the amount of seized cocaine and also the amount of killing. So, and we've seen it also in the Netherlands. Is a very interesting anecdote. So I believe it was 2012 in Antwerp. They interdicted 200 kilos of cocaine, but they didn't made it public. And there was a Dutch criminal group that smuggled the cocaine into Europe, and they got into a fight with each other because they thought some people within that group stole those 200 kilos of cocaine that were seized by officials. So we had a drug war in the years after, I don't know exactly, but 40, 50 people shot down in streets, people murdered that were involved, but by mistake. And I think it's very exemplaric. I don't know if that's the right English word, but it says a lot about how drug markets work in relation to law enforcement. So we influence also drug violence, because if we seize, then there can become a conflict, and then we have to solve murders instead of interdict drugs. And we see it now because a couple of months ago there was 1,400 kilos of cocaine stolen also in Antwerp, and now we as a Dutch police are trying to prevent drug war as we've seen before. So the reality, and Mayor Halsema will also tell this in a few days on the conference, and it's also my evidence-based policing perspective. Are we effective in this case, cocaine, how do you say it, to decrease cocaine smuggling or cocaine crime for that matter? And I think we aren't. There's more cocaine than ever. Then another drugs, ecstasy, MDMA. We talked about it just before. And in the Netherlands, there was a state committee, and they did very interesting research. And their conclusion is that ecstasy should be on the Dutch list too. So they stated ecstasy is a soft drug similar like cannabis, because of the health risks of MDMA or ecstasy. They are not so high. And the funny thing is, they said, no, but we cannot put it on list 2, because then the sentences for criminals would decrease, and that will be a problem then. And I was thinking, okay, but that's not the way the opium law works. It's made on the base of health risks and not on trying to sentence criminals who apparently are selling soft drugs instead of hard drugs. So we keep it on the hard drugs so we can be hard on crime. And also very funny Poppy Museum. So I was standing, because that's me, I was standing in a museum, and they were selling ecstasy. It were sugar pills, so it was not real ecstasy, but they were doing research. So if we want to regulate ecstasy, how should we do it? So there were 3 options. So you could go to like a pharmacy store, like where I'm standing, and you were being measured, and your height was being measured, and your weight, and then they could measure how much ecstasy or MDMA in the ecstasy you could get. And you get some instructions to do it on a safe basis. And behind that wall, there was another, like a smart shop. It was like a candy shop, a lot of colors and stuff. And there you could buy also your ecstasy, but then you had to take alcohol, breathalyzer, and some small questions. And the third option was like in a nightlife area, and there was like an automatic, and you just put in €5 and you could get your box of ecstasy. So it was a very interesting social experiment. I was there on a Sunday. The day before, there was a queue of 100 meters because people thought they could buy real ecstasy there, but that wasn't the case. So it was very funny. But I like this way of thinking about drug regulation, and also I think it's very important we can do that also in the public sphere. Then, maybe you can press, thank you. And this is also very interesting because this is a graph on the harm of certain drugs. And they included alcohol, and that's on the left. So if you see, and it's all different kinds of harm. Social harm, personal harm, etc., etc. And the funny thing, or the strange thing, is that alcohol has the most harm for society than all the drugs. And we can buy it. It's regulated, marked in the Netherlands, so you have to be of a certain age, etc. It wasn't, but now it is. And I think it's for me it's very difficult in the whole debate because alcohol is putting aside like that's not drugs and that's normalized, and yeah, you can buy it everywhere, and it's okay to get drunk and do stupid things. And when it comes to drugs, then a sort of morality kicks in, and then we say no, we have to prohibit it, and with a lot of consequences due to that. And the example of the prohibition in America is, of course, very known, and you see the similar effects on the prohibition of drugs. Okay, I think we can all agree on that. So, drug testing, so we do that in the Netherlands. I just looked it up because I'm no harm reduction specialist, but we don't do it on festivals anymore in the Netherlands because the tests are not accurate enough. So you can send your drugs to Trimbos, so there's a public health organization, and it takes like a week, and then you get your results of the drugs you gave. I think it's a very long term, 7 weeks, so, but that's the way it works in the Netherlands. Well, good question. I guess, yeah, I think it's free. I will look it up. Yeah. So this is in Dutch. I'm sorry. And we did it on festivals before. So, but that's also a debate. So we were for pro testing on festivals, and then we were con. So it's an ongoing debate. And we talked about it earlier, overdoses rates. So in the Netherlands, I think we have like 1 point. So 1 death per 100,000 people, so this is very low also in relation to other European countries. I think it's very interesting because in Poland the overdoses rate is less. And we just talked about the dark number of overdoses in relation to data collection. So that's very interesting. So also in the Netherlands, there are more overdoses than we registrate with all kinds of causes. But in the end, the way we deal with drugs doesn't make it that a lot of people are going to use drugs or overdose by the use of drugs. In the contrary, I think. Okay. Then we're going to wrap up. I like this quote from Benjamin Alexander Jean Roy. It struck me. So he wrote a very good report, and it gave me some insight also about how I think about drugs and how society thinks about drugs. And he says, get rid of the reflexes stemming from more than a century of prohibition. So what he in essence is saying, the way we think about drugs is already 100 years old, so it's been internalized in our culture. And what we need to do is, how do you say it? To get out of that culture, to look at it objectively, because otherwise you take your cultural thoughts with you in the whole debate, and that makes it very difficult. Then I will end with the paradox, the prohibition paradox. And I think we can see it now with cannabis worldwide. So for example, in Canada, now more than 72% of the whole cannabis market is being sold on a legal market. So that's tremendous. I hoped that they also could research what the effect of that was on organized crime, because organized crime is always involved, but we don't know yet. So I think that's a pity, because that answer will help also this debate, because the people who are pro-regulation say no, it will diminish organized crime. But we need to see the effect, and I hoped we could see it in Canada. But we didn't for now. Maybe it will come. So there are chances for countries who are going to regulate to also see what's the impact on organized crime. And if so, and also if you look at harm in a broadened sense, then you can see, okay, so what are the effects and the consequences of regulating? And then you could take a next step with the next drugs. And there's always like a debate on should you regulate all drugs, also the most severe. I think in time, you can tell that by looking also to regulation of the drugs we are regulating now. Thank you very much.
Thank you, Ruben, for a very comprehensive and fascinating exploration of the Dutch experience. Our final speaker for this session, Zaved Mahmood, joins us from drug policy. Well, he's the Drug Policy and Human Rights Advisor, lead on detention, incarceration, rule of law and democracy section. That's quite a title. Office of the UN High Commissioner on Human Rights. Zaved deserves particular thanks for joining us because he had some trauma on his way to us today and is hoping to be reunited with his laptop and his presentation in due course. But thank you for joining us anyway.
Good afternoon. Thank you very much. And also I'd like to thank the European Harm Reduction Association and other partners to inviting OHCHR to make a presentation in this session. After these two excellent presentations, I have been thinking that how I am going to present my what I wanted to discuss. But I think I will try to make relevant for the discussion also, because both of you, Neil and Ruben, they talk about two specific jurisdictions, two countries example, but I'm not going to do that, any jurisdiction, but I will reflect on our office, United Nations Human Rights Office, produced a report on drug policy and human rights, and impact of drug policy in the enjoyment on human rights, and also other UN system, within the UN human rights system, other entities also address this issue. I would like to bring those experiences, findings, or research, and which relate to today's discussion. I would like to reflect that. Also, already I know that you have heard from one of our colleagues, Elena Steiner, in the morning from the UN Torture Committee, Subcommittee on Prevention of Torture. She spoke, and also Michelle spoke, and subsequent second session also, a lot of discussion happened around human rights and framework. So please pardon me if I repeat anything. I was not in the morning session, I was traveling, but if I repeat anything, pardon me and bear with me. First, I would like to reflect on our report, which was produced by, last year upon request from the UN Human Rights Council. And some of you here present, I know you contributed in the preparation of that report. And it was based also, findings also based on member states, their contribution and their practices, what is going on around the world, those practices based on. In the report, we find out just 5 key challenges with regard to drug policy and human rights. And all these challenges also relate to the law enforcement to some extent, and our criminal justice system, I would like to say in a broader sense, because if we focus on the law enforcement, that's mean only talking about police and law enforcement authority, but criminal justice system, all apparatus involved, and what are the impact, whether it is prosecutor. I know in the morning we did, some prosecutor also were present here, judiciary, other part as well, judges and others. What is the impact then? First issue, I would like to highlight the lack of an unequal access to treatment and harm reduction, which we have been discussing here. And one of the key reasons behind that, the over-criminalization in many countries. 2 examples we have heard just a few minutes back. One was the de facto criminalization, which going on in, you mentioned decriminalization, but I will say that de facto criminalization through the practice of the law enforcement agencies. And some country is almost going towards the decriminalization, like Netherlands or other countries through the legalization. I would like to come back on the issue of the access to treatment and harm reduction. In this context, when there is a criminalization, it is really difficult for the police official or the law enforcement to act promptly in some cases, or also they do have a doubt about that, what they are going to do if there is no clear instruction in this kind of situation. Just let me give you a very personal experience. Just yesterday, I was walking in my neighborhood with my little dog, Greta, and suddenly I found someone on the street. And I realized that it is really serious situation. Immediately I called police, and it is in London. In London, I called 999 and 911, just all this number, and then police ambulance came within half an hour. It was really interesting, the doubt between the 2 police officers. They are discussing what to do, how to respond to that. And I was just observing. I said, yes, it is 2 of them just really wanted to take action immediately, asking ambulance to come and all these things. Another one is reluctant. So I didn't interfere to their work, but I was observing that what action or what kind of response is coming. But I realized that just that response in the street at the moment, it was a lot of interest by the officials to react on, but also they have doubt because of unclarity, which you mentioned, that no clear instruction or criminalization, or they are trying to, through practice, doing the de facto criminalizing, but it's sometimes difficult. That could be also remedied or could be solved by other part of the system. Let me give you an example from Scotland. Just last year, their chief law officer, prosecutor, or Lord Advocate General issued a circular or instruction or guidance mentioning that if anyone coming to the drug consumption room, which they just opened, the Thistle in Glasgow, the name of the consumption room, if anyone coming to take treatment or anything, she's instructing that it's not going to be the priority of the prosecutor. Police should not act upon on that. So through that instruction, prosecutor is giving some sort of clear guidance to the police. This is not my priority. I'm not going to take up on this kind of cases, personal use. Through one hand of the criminal justice system, giving the instruction to the police to act to realization of the right to health of that particular individual who is coming to take treatment or harm reduction or other services from the drug consumption room. So different institutions in the criminal justice system can play a role between themselves and to support each other. I think that Scotland example is really interesting to see that how prosecutor, law officer, chief law officer interpreting his or her right to protecting right of the people. And also giving instruction on the law officers or others how to react in this kind of situation when someone is really distressed or drug-related problem having and coming to the drug consumption room, protecting them. That is really important, that the role law enforcement official can play a good role or necessary active role when the other part of the system could guide them. That like prosecutor and chief prosecutor in Scotland guided them. The second issue which we have identified in our report, that is over-incarceration and prison overcrowding. This is also, again, related to over-criminalization, over-punitive approach. And we know that 20% prison population in the world for drug-related offenses. And within that 20%, 67% of them for only minor offenses, drug use, and all these things. It's a global. I think that in this region, particularly EHRA region, scenario is more or less same. That large number of people in the prison. In this context, also I would like to mention that prison context, another issue is that the torture. Even human rights treaty bodies and others found that if the withdrawal of treatment, if anyone in a prison and during that time, the withdrawal of treatment due to just focusing on taking the confession and all these things, that withdrawal of treatment could constitute torture. And that is which is absolutely prohibited. But unfortunately, in this reason, we have record it happened that in the prison system or even police custody, withdrawal of the treatment to extract confession and all these things, it happened. So that also, I think that we need to look at that whether any action by the law enforcement officials or criminal justice system as a whole, that any action is turning to a torture. Torture doesn't need to be beaten or anything. Just simple withdrawal of treatment could constitute that one. It is important to police official or law enforcement official, criminal justice system official they need to look at. Third point, I would like to highlight the impact, disproportionate impact on vulnerable groups. In the report and in your finding, we have seen that vulnerable groups, particularly youth, we have discussed here that, but also I would like to mention other vulnerable groups, whether related to race or minority. For example, in this region, some part of this region, people of African descent, mainly African or black people, they are being stopped and searched regularly and frequently, comparing to their other peers in the society. That is one of the issues we have found, that there is a systematic problem in some jurisdiction with the police authority, how to deal with minorities or people of African descent. Within the minorities, also in a broader region, this region, we have seen against the Roma people. Even Roma population, that how to handle with them, and if anyone caught with drugs and other substance, or even alcohol, as we mentioned, this is the highest reason for harm. But this minority population also being targeted in some jurisdiction that need to be also looked at. And in our report, we have specifically recommended that law enforcement officials need to have their own training manual, or to develop their capacity to understand the minorities, understand the vulnerability of the specific population in the country or in their jurisdiction. Gender implication of drug policy. When I'm talking about gender implication of drug policy, I apologize. This whole panel is male-dominated panel. But our colleague Ghana, just assured me in the morning, there were female presenter, don't be worried. In our office, we have policy not to sit in a panel when it is all male. Anyway, I'm here. She told me that I'll be with you. Thank you very much. Coming back to the gender implication, we have found that women are disproportionately affected by incarceration for drug offenses and face significant barrier in accessing treatment and harm reduction. It's barriers also in the context of whether it is police custody or in the prison, that one. If we look at the services, what women they are receiving or situation is really, it shows that there is a disproportionate response, or not ensuring that women are protected in this kind of situation. Existing harm reduction services also fail to address the women's specific needs, particularly integrating sexual and reproductive health services, resulting in significant gender gap in treatment access and effectiveness. In the context of gender, also I would like to highlight the situation of the LGBT people. LGBT people and drug use and their relationship with law enforcement authority in many countries is really severely disturbing. In a sense, it's the intersectionality of discrimination. Discrimination as a member of the LGBT community, and then again being identified as a drug user or drug addiction and all these things. This kind of intersectionality put them in a more vulnerable situation, that one. Last point I would like to highlight that in our report, and I think it is very relevant now in the context in this region, that is drug use in a humanitarian context, particularly when where is the war going on, or humanitarian crisis, or also other crises like we have seen health crisis during COVID time. And this kind of situation, there are some specific element need to be looked at by the law enforcement and everyone, that when people in a distress situation, and how to ensure that they have access to what they need, the support they need. Particularly, we have seen that in our report, also other report, we have seen that in a humanitarian crisis, and when war is going on, or conflict is going on, this population, people who use drug in the humanitarian crisis, they're totally marginalized. Very little focus has been given to them. In this context, also, local law enforcement officials, or in the refugee situation, who are protecting those situation, what role they can play to support this kind of this population, particularly refugee, asylum seeker, and others who use drugs. They do use drugs. We can't say that they don't use that. We have noticed that there is a large number. I know that UNHCR and UNODC, they are looking at this issue to some extent, how to address. This is new area for all of us, all UN agencies, not that much we have addressed. I think there is a need for more research and evidence. Both colleagues mentioned about the evidence data. From that specific context, we need to identify. I will go back and just in the report, we will share the report. I not forget, it is arriving, some summary booklet. I think tomorrow we'll be distributing in the conference. You will find this. You will see in the report also, we highlighted some positive example. Including example from Amsterdam. That one, I will come back a little bit later, a few seconds later on that. And also from in Ireland, Safer Nightlife program was launched in May 2022, and which gives the responsibility to support making the nightlife culture responsible. That is the whole key issue, that just all these areas, all these stakeholders, how they could be responsible for the people's life, people's health, and all these things. To make it more in that direction, the Ireland, they did that. Also, we know about in Switzerland that supervised consumption rooms. This I have witnessed few of them in Geneva and other places as well.
Could you explain how does it work? Because it was safe consumption room, supervised consumption room, and people could not know what is happening in there. Just simply what people is allowed to do there, or they are just tested for HIV as at mobile clinics in our region.
No, in Switzerland, there are more than, it's a consumption room. I'm saying consumption, it's not only testing, it's even consumption. They're offering them...
So I'm coming with my drugs, nobody taking me to police. I'm coming, getting needle, shooting.
Exactly.
Somebody see if I'm not overdosed, getting other health services and going out freely, and police not standing around the corner, no?
Exactly. The same thing just in Switzerland. Thank you for the clarification. It's really good way to put it. Same thing happening now in Glasgow consumption room. Exactly, that supervised consumption to save people's life. It's not to promote drug use. That they are going to take this drug, but how to supervise them and keep a safer environment and providing.
Right across the corner, the Geneva railway station, I've seen
Exactly,
it.
You have seen that there. I was going to talk about the good practice about the Netherlands. Already Ruben mentioned about the Amsterdam initiative, and also on 4th December, our High Commissioner is going to speak through video statement in that, supporting the initiative by the Mayor of Amsterdam. Also, I would like to bring one example, good example from United Kingdom, mainly Scotland, that on 11th December, Scotland is going to launch, the First Minister of Scotland is going to launch a Charter of the Right of People Affected by Substance Use. the Scottish Charter, it is going to be the first kind of charter in the whole world. This is going to be the first one, this kind of charter. The Scottish Charter of the Right of People Affected by Substance, which includes also role of the law enforcement officials and others, what should be role vis-a-vis people affected by the substance use. Many countries, you already, Ruben mentioned about decriminalization and legalization. I don't want to name those countries I already mentioned. However, I would like to highlight one thing. The decriminalization on its own cannot be effective. We have to understand that we have seen from some jurisdiction that unless decriminalization is accompanied by comprehensive support service, then it would be ineffective in addressing the root causes of substance use disorder, improving public health outcomes. To be effective, decriminalization should come with comprehensive health and social services, including harm reduction, which we are discussing today, evidence-based treatment, support for social reintegration. I would like to highlight this issue, which would include also housing. Many countries in this region and also globally that drug use and homelessness goes together. Without resolving the housing problem or homelessness issue, we do not think that any decriminalization program will be, or social program will be effective. It is need
you will kill me and our facilitator will kill us. But in this region, in Soviet Union, housing means to receive from your industry free flat for your family living. That was used to be in Soviet Union. Free, like, for your life. Yeah. What do you mean by housing? Is it shelters? Is it providing the social
it could define
home?
By local context. For example, UK social housing they have. UK social housing, but to get into the social housing, particularly people who use drugs, and this is really difficult. In some countries, social housing issue or social security issue are barred. The people who use drugs, they're not allowed to get into those services. They are being, even sometimes in few countries, they don't have right to vote, that one. So what I was trying to mention, that decriminalization, legalization, this will not work alone if society as a whole and government, state authority as a whole do not address this issue. I'm sure, Neil, and you will agree that homelessness is an acute problem. And also we have seen in Oregon, why Oregon model is failing, just a lot of criticism there, because it was not comprehensively considered, the program. Only decriminalization, few legal changes in the law is not enough. It has to be comprehensively. And it will also be not useful for the law enforcement and other criminal justice system if it is something like that, just people is using drugs, drug use. Also, I think that it is important we have to distinguish drug use and drug use disorder. Lot of drug use happen in the world, which is not a disorder. Whether it is in the clubbing and all these things, we can't say that, because when you're talking about harm reduction and others, definitely it has to be look at drug use order, particularly look at, and it has to be comprehensive model. I would like to mention two specific tools in the region which is relevant. I'm going to finish 2 minutes. Yeah. Two specific region tool. The Council of Europe's Pompidou group, they has developed the self-assessment tool for drug policy compliance with human rights. This is really interesting tools also for law enforcement officials to look at, that in that tool, there is an indicator giving the self-assessing. The law enforcement officials, whether they are looking at their responsibility and what are the measures they need to look at, what are the indicators they need to look at. This tool is really for the whole Council of Europe. I would also like to request the civil society organization to look at and use it to for advocacy tool as well. Last tool I would like to highlight that international guidelines on human rights and drug policy, which we have worked with other UN agency, UNDP, one of your partners here, UNAIDS, WHO, and OHCHR with the civil society, Essex in academia, and also some member states. It was developed, and last year, Human Rights Council of United Nations acknowledged these international guidelines through their resolution on the drug policy. These guidelines also give specific guidance for the law enforcement officials and criminal justice actor to look at how to develop their policy with regard to drug use disorder, and substance use disorder, and keep human rights framework in their policy making and implementation of this policy making. With that note, thank you very much. Available for questions. Thank you.